Well, hey, everybody, this is Robert, and welcome to Outbreak News Interviews. And on today's podcast, we're going to take a look at a parasite that's relatively common in people. However, and fortunately, actual disease is pretty rare. And that parasite is Toxoplasma gondii. Now, joining me today for a Toxoplasmosis 101 is Fatima Khan. Fatima is a parasitologist who hails from Islamabad, Pakistan, and she has written about parasites for several media outlets. Hi, Fatima. Welcome to the program.
Hello, Robert. Thank you.
Okay, good. So let's go ahead and start out with a little overview for the audience. What is Toxoplasma gondii and what is toxoplasmosis?
Basically, Toxoplasma gondii is a parasite. It's a single-celled protozoan, which is causing toxoplasmosis. And toxoplasmosis is the disease caused by Toxoplasma gondii, which is more injurious to pregnant women and people with compromised immune system. Rather, people with normal immune system are gonna develop very normal symptoms like flu, rashes, muscle aches, and swollen lymph nodes. It's like that.
Now, how common is this parasite worldwide?
It's a very common disease all over the world. But the US has the highest mortality rate, as it's a foodborne illness. In the foodborne illness, US is the most affected one, and 30 to 50% of the people in the world have gone through toxoplasmosis. Like everybody, like maybe you and me have got toxoplasmosis, but we just don't know. Like when we did get, like we did not get tested for toxoplasma gondii, so maybe we also got toxoplasmosis once in our life.
Okay. Um, can you talk, as a parasitologist, can you talk a little bit about its life cycle and its association with cats?
Yeah, basically, cat is the definitive host, and I'm gonna start the life cycle with the egg stage, the oocyst stage, which begins because it begins from the cats. Like the cat's feces has the eggs, the oocysts. The thing is, a sexual cycle of the Toxoplasma gondii is completed inside the cat's body. When it's the last stage, it's the defecation stage is there, like the oocysts are defecated, and that's in the feces. And basically, human or some rodents or any other warm-blooded animals are the intermediate hosts for the life cycle. So the eggs are basically ingested. Now I'm going to talk particularly about the humans because we are humans, so we are more concerned. We're concerned for everything, but like humans are most important because we ourselves are like the most important for ourselves. So the thing is like humans are going to ingest the eggs, and the ingestion of the eggs is basically if you don't handle the cat litter properly. Obviously a lot of people have pets. They do take care of the pets. They do take care of the feces. They do they have to they have to clean the litter. They have to do everything of the cat. So basically, if you don't handle the cat litter properly, the cat which was which was infected with Toxoplasma gondii, and the feces are gonna have the eggs. So if you don't handle the cat litter properly, your nails are gonna have those oocyst eggs, or you might after like cleaning your cat, you're gonna maybe touch vegetables. You're gonna start cooking, and maybe you're gonna make a salad, and like you just ingest the eggs. However, whatever the reason is, you're gonna ingest them. For like I don't know the how are you gonna ingest, but a human can just ingest if you don't handle the cat litter properly. And then obviously it's gonna enter your body, and the stage it's gonna enter is tachyzoid. Tachyzoid is a stage when there's a division, like very rapid division of the Toxoplasma gondii in your body. And then the finally it reaches a stage which is known as bradyzoid stage. The bradyzoid stage is a stage which is a dormant sort of stage. which is a slow stage. It does not have that much of division. If the division is there, but the thing is like it's very slow. And the thing is it's a cyst stage. The cysts are developed in the whole body, like especially if it's in the toxoplasma gondii has entered your muscles, the cysts are going to develop in the muscles. If it has entered your brain, the cysts are going to develop inside your brain. So this is how toxoplasma gondii affects human then, because when the cysts are going to develop inside the brain, that's obvious that the brain is gonna have encephalitis, and you're gonna face encephalitis, which is injurious to a normal human too. But like I'm just telling, this is the life cycle, and this is how the cats are involved in the cycle. Like this is the like how the transmission works from cat to the human then.
Very good. So, how do people get or contract toxoplasmosis? What are the modes of transmission?
Basically, the thing I've told before, it's people do say it a foodborne illness, because the thing is, when you don't have a proper sanitation system, proper cleanliness, everything is related to the cleanliness, like hygiene. It's all, everything depends on your hygienic levels. If you wash your hands properly, if you don't eat something which is like which has something related to cat's feces, like cat's litter, if you just clean your vegetables properly, if you clean the meat properly before cooking, if you clean your hands properly before cooking, you're never gonna develop. But if you don't have proper hygiene, if you don't handle the cat litter proper, if you don't wash the vegetables before eating, if there is a like a bit of issue in the hygiene, you might develop toxoplasmosis, because toxoplasmosis is all related to good hygiene then. If you have a good hygiene, you're never going to develop it. If you don't have a good hygiene, if there's a bit of mistake in your hygiene, you don't wash your hands proper, you just don't handle the litter proper, you're going to develop this disease.
Yeah. Um, Now, you talked earlier in the interview that most people contract it and they're asymptomatic. However, for those people that do have symptoms, what do you see?
Yeah, basically, the symptoms mostly people don't develop any symptoms, like they're asymptomatic. But like people who develop symptoms, like normal people like us, they're gonna have flu, rashes on their body, swollen lymph nodes, muscle aches, and stuff like that. But the people who are going to have compromised immune system, have less CD4 count, they're going to develop encephalitis and much more issues in the body. Like it's going to be creating a lot of problems because your immune system isn't working at all. And the thing is, thirdly, the toxoplasma gondii is most associated with pregnant women. Pregnant women, pregnant no, women are basically affected by Toxoplasma gondii, because their fetus is affected by Toxoplasma gondii. When the Toxoplasma gondii enters the pregnant woman body, it enters to fetus through placenta, and that is gonna cause a lot of complications in the birth of the baby. First of all, a lot of women face abortions. Then secondly, stillbirths. There's hydrocephaly, a lot common in women which give birth to the baby. And then babies have problem of mental retardation, and like the development issues are there, and there are a lot of complications with the baby, with the fetus. So basically, Toxoplasma gondii affects pregnant women a lot, because it's not affecting the pregnant woman, it's basically affecting the fetus then.
Right.
So toxoplasmosis is more like very injurious to a pregnant woman.
Now, recently you had an article that was
Yeah.
published in the Gulf Observer entitled, "Can Cats Be the Reason for Female Pregnancy and Abortions?" Can you talk about that?
Yeah, yeah. I told you before, as cats are the definitive hosts. So it's a very like common thing. A person can obviously get toxoplasmosis through cats, But the thing is, if you take proper care, if you have proper hygiene, if you wash your hands proper, if there's proper sanitation, if you do take care of the stuff, everything before you eat, before you do something, because there are certain there's certain habits people have most. There are a lot of people, they don't wash their hands before eating. So people like that can develop toxoplasmosis very easily. And obviously cats can be the reason for abortions then in the pregnant woman, because they're gonna enter the Toxoplasma gondii is gonna enter the placenta, and then it's gonna affect your fetus. It's gonna have like a lot of women do get abortions and do get stillbirths and stuff like that. But the thing is, if you handle the stuff properly, you're never gonna get those problems. And then you can just keep your cat, but you need a proper hygiene.
Okay, good. Um, Now, speaking of cats themselves, does the Toxoplasma parasite cause disease in cats?
Yeah, but the thing is, cats really don't develop that much of symptoms. Like their common symptoms like flu, diarrhea, respiration problems, and fever. These are the only symptoms which do appear in the cats. Nothing else than that. They don't have problems like pregnant women.
Um, Concerning the diagnosis of toxoplasmosis, what kind of methods are available for diagnosis?
There are some of the methods. Like first of all, I'm gonna talk about PCR. PCR is polymerase chain reaction, and the PCR is we can just do the PCR with the blood of the patient, and secondly with this cerebrospinal fluid of the patient, and or some other fluid of the patient. You can just do the PCR and observe the bands, and then you can just know that if the patient is positive for Toxoplasma gondii or not. And secondly, I'm going to talk about Toxoplasma avidity. Toxoplasma avidity is a thing that is gonna like you can diagnose the Toxoplasma gondii by antibodies in the body. Like people having very recent infection of Toxoplasma gondii are gonna have IgM antibodies, and people having old Toxoplasma gondii infections, like they did get toxoplasmosis, but in the past they're gonna they're like those people are gonna have IgG antibodies. And basically, the Toxoplasma gondii avidity is the bonding to the to the antibody. Like avidity is the bonding of antibody to the antigen. And if IgG is bonded very strongly to the antigen, like Toxoplasma gondii, then the infection was very old. And if it's not bonded that stronger, the bonding isn't that stronger, then the infection is a bit recent. Not that recent like IgM, but recent.
Um, Fatima, can you go ahead and talk a little bit about treatment? How would a physician treat somebody
Yeah.
with severe toxoplasmosis?
Basically, you have certain medications for toxoplasmosis. Pyrimethamine is the common drug which is prescribed in case of toxoplasmosis, which is accompanied with an antibiotic. And the thing is, it's a sulfadiazine. You can just prescribe pyrimethamine and sulfadiazine, and you can also treat it with clindamycin instead of sulfadiazine. And then that's for a common like a normal patient. And then I'm going to talk about the pregnant woman. Pregnant women can be treated with cipramycin, and this is the common drug which is prescribed to the pregnant woman then.
Okay, and lastly, when we're talking about prevention, obviously you talked about the modes of transmission are, foodborne and possible exposure to cat feces and cat litter. So obviously, good hygiene, cooking your meat properly. Uh,
Yeah,
Maybe pregnant women and immunocompromised people should avoid changing litter boxes. I
yeah,
mean, is that what we're looking at when we talk about prevention?
yeah. Obviously, that for pregnant women, like the thing is, first of all, it is concerned with the awareness. If a woman is gonna have the awareness that she's gonna get Toxoplasma gondii if she's gonna deal with the cat litter, obviously she's not gonna handle the litter boxes. But a lot of women don't have any awareness about Toxoplasma gondii, especially they don't know what are parasites. And a person having no biological background will have no, they will have no concept, rather they will have no, like they won't have a concept that like if they're gonna touch the litter boxes and they're gonna have an abortion. Like so the thing is basically awareness. And if the thing is like if you have awareness, then don't handle the litter boxes like of the cats. And if you don't have the awareness, first of all there should be awareness, and second of all that you should not handle the boxes, because the thing is like it's like you're getting yourself into the disease. Sometimes if you wash your hands properly, still there's gonna be something in your hands, in your nails or something like that, because a lot of women have long nails and stuff like that. So the thing is a very bit of thing is gonna make a very big problem.
Okay, well, very good. And I want to thank you, Fatima Khan, for sharing your time and your expertise with me today. I appreciate it, ma'am.
And thank you.